Hey, good afternoon, everyone. You're not able to see myself or our guest panelist, Dr. Matthew Davis, because we're having some technical difficulties, but I think you can hear us. And so we'll proceed this way, and you'll be able to see the visuals, which is the most important thing, I think. So I want to welcome everyone to the Institute of Medicine of Chicago's virtual series of the 8th convening of the State of Health of Chicago and our third session in 2021. We have conducted 13 sessions since the fall of 2020, so we've been really busy trying to get some good content out to you, as well as good dialogue around the various topics we've discussed. And really, if you're not familiar with the Institute of Medicine Chicago, our focus is to create a collaborative systemic change in a time of a pandemic through discussions, thought leadership, and building thoughtful, meaningful dialogue with expert speakers and with you today. And I think we're making strides toward improving health equity and well-being in our communities. But there's still more work to be done. And this is why we've challenged ourselves with the theme, We Can Do Better. Over the past 100 years, we can go to the next few slides here. The Institute of Chicago Medicine has made significant contributions to the practice of medicine, the business of healthcare, and public health. As a uniquely multi-institutional and multidisciplinary organization, IOMC provides an independent, neutral forum for Chicago's region's health leaders to convene, collaborate, and contribute to the health of the city. My name is Raul Garza, and I serve as the president and CEO of Aunt Martha's Health and Wellness. And it's also my privilege to serve as the Vice President of the Board of Governors for the Institute of Medicine of Chicago. And it's my pleasure to welcome everyone today. I would like to thank the IOMC Board of Governors for their leadership and support of the State of Health of Chicago this year and their efforts with obtaining support for all these programs. And a special recognition to our chairwoman, Dr. Cheryl Whitaker, who normally would be moderating this discussion, but she's got a few other things going on, so I'm honored to step in on her behalf. IOMC is an independent organization of distinguished leaders in the health field who collaborate to improve the health of the public. We are proud to draw upon the diverse membership and other regional leaders to address critical health issues. Before we move forward with today's program, I would like to share with you some of the upcoming events and programs. On April 23rd, IOMC will host a program called The Path Forward for Nursing Home Residents, Lessons Learned from the Pandemic. And obviously this has been a topic out in front, the impact that COVID has had on our nursing home facilities and unfortunately, consequently, the residents. Ms. Patricia Merriweather Argus, who serves as the Executive Director for Project Paint Care and a Fellow and Board Director of the Institute of Medicine of Chicago, will lead the session with our expert panel discussing the physical and mental impact of COVID-19 on nursing home residents, pre-vaccine and post-vaccine, recognizing the key factors leading to the COVID-19 crisis in nursing homes, and finally, comparing the pandemic's impact on Black and Latinx residents and staff. So there's a great amount of information and misinformation out there today, and we hope by attending this session, it will clarify the current situation and offer new ideas to consider for moving forward during this pandemic. In May, we will address medical marijuana. That's a topic that's been out center and in front over the last several months. What does it mean, and is there equity? And then in June, we will hold our annual election of officers and hope that you will attend the annual meeting, and this will take place on June 25th. So let's talk about today. Today's agenda includes a presentation from a well-known, well-regarded child advocate, pediatrician, and a leader, not just a hospital leader, but a healthcare leader, Dr. Matthew Davis. His presentation will be followed by a Q&A session, which you will be able to participate in. And I'm just going to cover real quick just a few of the objectives for today's presentation and discussion. So what Dr. Davis will lead us through is recognizing how parents' level of concern about the pandemic and their intentions to vaccinate their children against COVID-19 have shifted over time. Identify the top sources of parenting support during the pandemic, and then associate how the pandemic has impacted youth mental health. And according to Dr. Davis's work, 55% of Chicago parents say they find it difficult to balance their responsibilities at work and at home. 58% report worrying about child and family issues while they are working. And then, of course, Dr. Davis will shed some light on these challenges and others. We'll also talk to him about his upcoming report on youth mental health. This program is accredited by Rush University and affiliated associations. You will be able to obtain your continuing education credit by completing the electronic evaluation at the end of the program. All speakers met the disclosure requirements for this program. And so finally, we wish to thank our State of Health Chicago sponsors for the generous support of the entire series. At the benefactor level, they are Blue Cross Blue Shield of Illinois, so thank you for your support. At the partner level, Northwestern Medicine, thank you. At the friend level, Rosalind Franklin University of Medicine and Science, and the Urban Health Initiative of the University of Chicago Medicine. At the innovator level, the Portis Foundation, Michael Reese Research and Education Foundation, Washington Square Health Foundation, Hectone Institute, and Complete Care. And then finally, at the colleague level, Care Advisors, Gold Square, and my very own Aunt Martha's Health and Wellness. And so thanks for your patience and thank you for all your support. And I just would like to now formally introduce Dr. Matthew Davis. It's my pleasure. In July 2020, Dr. Davis was appointed as the chair of the Department of Pediatrics at Northwestern University's Feinberg School of Medicine. In that same month, Dr. Davis was also named chair of the Department of Medicine, president and chief research officer of Stanley Mann Children's Research Institute, and the president of the Pediatric Faculty Foundation at Lurie Children's Hospital. In addition to his appointments last July, Dr. Davis continues to serve as Lurie Children's head of Division of Advanced General Pediatrics and Primary, as well as its executive vice president and chief community health transformation officer. He is also a professor of pediatrics, medical school sciences, and medicine and preventive medicine at Northwestern University. Dr. Davis is a primary care pediatrician and internist with a special interest in providing care for children with special health care needs and supporting adolescents and young adults as they transition into self-care in their life course. His academic focus is on community-centered population health focused research across the life course, with a particular emphasis on the family context and the impact of local, state, and federal policies on child and family health. He created the Voices of Child Health in Chicago program as a way to bring the voices of Chicagoans to the forefront of child health research in the city. As the program's founder, Dr. Davis oversees development and implementation of the kind of survey research we'll explore today. Research that's focused on better understanding the issues that impact child health in Chicago. Dr. Davis graduated from Harvard Medical School and obtained his MAP at the University of Chicago. His postgraduate training included an internship at Brigham and Women Hospital, internal medicine and pediatrics, and completed his residency at Harvard Medical School, internal medicine and pediatrics. I've also had the honor to work with Dr. Davis and Aunt Martha's Health and Wellness in a pilot program that we launched a little bit over 3 years ago. That was really the first care coordination effort for children in the Illinois Department of Children and Family Services child welfare system. And I think I will say from a bias perspective, I thought we did great work together. Matt, it's great to have you with us today. Thanks for all that you do in the community. I was going to ask you what you do on your spare time, but I don't think you have any. I think this is your life's work. So welcome, and I'll hand it off to you.
Raul, thanks very much for that introduction. And I really have enjoyed working with you and the team at Aunt Martha's, as together, Aunt Martha's and Lurie Children have really tried to approach the needs of children who are youth in care in the Department of Child and Family Services by connecting behavioral health and physical health. And it's really been a pleasure working with you on that.
Thank you.
So I want to thank the Institute of Medicine of Chicago for the invitation today to share some of our work at Lurie Children's, focusing on the voices of parents and elevating the concerns of families across our city. We started the Voices of Child Health in Chicago effort as a way to survey Chicagoans from all 77 community areas depicted on this map. And through doing that, to understand better the issues that impact youth health and well-being in our city. Oftentimes, as is the nature of healthcare and public health, naturally, we focus on the needs of populations and groups in our populations that are experiencing very heavy burdens of often chronic illness. And that often involves a lot of focus on adults. And yet we all know on this call, and I bet many of you have contributed to some of this knowledge and awareness in our communities, that many of the antecedents of adult health concerns come during childhood. And the more that we can effectively address those concerns in childhood, in adolescence, through our communities, through families, through partnerships amongst our organizations, the healthier Chicago we will have in the future. I want to remind everybody that this is very much designed to be a conversation today. I'm going to be sharing some of our team's work on the Voices of Child Health in Chicago, and we look forward to trying to answer as many of your questions as we can. Just enter them through the Q&A function at the bottom of your screen. Next slide, please. A bit about the Voices of Child Health in Chicago. When we designed the Voices of Child Health in Chicago, it was designed to be a multi-partner platform. And by that, I mean, we started out in our work teaming up with the Chicago Department of Public Health and a long-standing survey platform they have called the Healthy Chicago Survey. The Healthy Chicago Survey, not shown on this slide, is a telephone-based survey that for several years has been the main way that our city has kept track of progress towards goals that we have in the Healthy Chicago platform that serves as a map for us all in terms of trying to improve community health at the population level. That said, we added modules of questions to the Healthy Chicago Survey and created with the city something that we affectionately call Healthy Chicago Survey Junior. Now, Healthy Chicago Survey Junior has served as the source of data for a number of reports that we posted online at our Voices of Child Health in Chicago website. And we still wanted to do more in terms of trying to understand how parents' perspectives may change over time. And that's why we started what I'm going to be sharing with you today, which we call the parent panel of the Voices of Child Health in Chicago. And to accomplish this, we work with the center called NORC, or originally the National Opinion Research Center, based at the University of Chicago, really one of the preeminent survey groups in the country, if not around the globe, and certainly a great partner for us to work with here in our city. So as I mentioned, we sample Chicago parents from all 77 community areas. We are very dedicated to making certain that we hear from every corner, every neighborhood of this great city in order to reflect in a representative way of the voices across the city and the different perspectives that parents have. So working with NORC, we recruited by mail at least, and focused on households with at least one child under age 18. Importantly, the respondents have a choice of answering each survey either online or via phone. Their preference is what matters here. And also importantly, we administer it in the preferred language of the respondent, either English or Spanish. I'm going to be sharing with you data collected in wave 1, which as you can see here occurred May through July of 2020, and then wave 2, November 2020 through February 2021. Our goal is to achieve at least 1,500 respondents for each survey, and all analyses I'm going to be sharing with you today are population weighted. What that means is we've taken the respondents that we had, we adjust them for the population characteristics of Chicago so that we can say with confidence that the patterns I'm going to share with you are reflective, we would say representative, of families across our city. Next slide, please. I'm going to focus on 4 different topics here, and I suppose it goes without saying that the perspectives we'll be focusing on today from parents are really heavily influenced by the context in which we've all lived over now the past almost 13 months. We're focusing first on parents concerned about COVID-19 as an illness and a burden for many of the underserved communities in our city. And we're going to take a look at parents' trust in information sources, which of course is a major concern for many of us on this call as we try to deliver unbiased, accurate, scientifically driven information to all communities. But we're not the only ones delivering information, and that becomes a challenge for all of us. We're going to take a look at vaccination intentions, focusing on a group about whom not much has been said with regard to vaccination, and that's children. We're going to take a look at sources of parenting support, because we want to be able to reflect on ways in which we in healthcare and we in community health can support parents the best we can. And we're going to close with some of the parents' perspectives about children's mental and physical health. Next slide, please. So the first question we asked here is, how concerned are you about the coronavirus or COVID-19 affecting your family's health? And I should mention here that our survey team that's led by Dr. Marie Heffernan is focused on trying to ask questions in a simple way that will be very accessible to a non-healthcare audience, that is to say a lay audience, and we pilot these questions to make certain that we are achieving that objective. So these questions here are deliberately designed to be readable at a 6th to 7th grade level and easily understandable by a person not from a health background. There are other survey researchers who ask questions in a more complex way, and certainly they're welcome to do so, but we wanted to make certain that all Chicagoans who we contact are going to be comfortable answering these questions. So with the question that you see here on the screen, in survey wave 1, which as a reminder was last spring to summer, we found that 64% said they were very concerned, 31% somewhat concerned, and 5% not concerned about COVID-19 affecting their family's health. Then next slide, as we take a look at the same question and how it showed up in wave 2, we see here a slight change. It turns out to be a statistically significant change, and a decrease in the proportion who are very concerned, a slight increase in somewhat concerned, and the same proportion who are not concerned. Next slide, let's take a look now at how those proportions differ by individuals' self-reported race and ethnicity. You can see here those 3 categories: not concerned, somewhat concerned, and very concerned by Black non-Latinx, Latinx, other/multi-race non-Latinx, and white non-Latinx. These were the 4 most common self-endorsed categories in the survey, and the multi-race category was combined with other for purposes of presenting these data here. As you can see, we have one of the boxes grayed out because there were too few respondents to be able to have a statistically robust estimate. But you can see here on the far right of the table that non-Latinx Black parents were the most likely to report being very concerned about COVID-19, slightly higher than the Latinx number, and in turn slightly higher than the other/multi-race group. As we are all aware, based on the numbers reported by the city of Chicago, these levels of concern match directly with the burden of COVID-19 illness that have been experienced by individuals from the communities that you see listed on the screen. In other words, and I'm saying this as a survey researcher for the last 20 years of my professional career, the public reflects what their awareness is, and their awareness so often reflects exactly what we're measuring in the public health arena. The public is smart about the burdens of illness that they experience. In fact, my bias is that we often learn directly from the public, even more than we learn through other methods, and that's why I'm a particularly enthusiastic survey researcher, and that's why we built the Voices of Child Health in Chicago, to make certain we understand these perspectives directly from the community. Next slide, please. Now let's take a look, and these may be somewhat surprising findings for you, and we're sharing with these with you. We have not published them yet in a broader fashion, but we're delighted to share them with you because we consider these to be the findings for the city of Chicago, and you all can carry them forward and use them in your work, because I know so many of you are focused on trying to reach communities of need, especially during the pandemic, as we all continue to grapple with it. So you can see that in wave 2, which was measured very recently, Latinx parents were now the most likely to report being very concerned, but you see there's been a decrement in levels of concern among the groups in the top 3 rows here. Non-Latinx Black parents are substantially less concerned. Remember, that number was up over 70% in the last slide. Latinx somewhat less concerned than they were back in wave 1, and other / multi-race non-Latinx substantially less concerned, now down about to the levels of non-Latinx white parents. This reflects a couple things. First of all, perhaps a slightly diminished burden that we're experiencing during this wave, although I would say that the first part of this survey window, November to December, was the second and larger peak of COVID-19 activity here in the city. So we're concerned in our team that this may reflect some so-called pandemic fatigue, where although we are living with at least as high levels of COVID-19 in our community as back last summer, there's a sense that we're beating it, when in fact we still have a ways to go here as a community, and the sense of being very concerned has diminished. Next slide, please. It turns out, and perhaps not surprisingly, those levels of concern connect to parents' intentions to vaccinate their children over time. So I'm going to share with you findings from wave 1 and wave 2, asking exactly the same question about future, not currently yet available vaccines for most children, that is to say children under 16, most recently in terms of the vaccines that have been authorized for use. So wave 1 was asked when we didn't even have any approved vaccines, how likely would you be to get yourself and or your child vaccinated against COVID-19 if a vaccine were available? And you can see there about half of parents said they were very likely to get a COVID-19 vaccine for their child. Another 19% said somewhat likely, and 16% not likely, about the same proportion, not sure. Now take a look on the next slide about wave 2. Wave 2, after we started to see some emergency use authorization for COVID-19 vaccines, a significantly lower proportion of parents now intend to get their children vaccinated against COVID-19. 38% now very likely, 24% somewhat likely, a larger proportion not likely, and 16% remain unsure. Based on what we've already shared with you about the sense of the burden or the risk of COVID-19, the level of worry from parents for their families about COVID-19, the likelihood among parents of getting their children vaccinated against COVID-19 seems to be waning here in Chicago. We are not aware of any other survey team that has this type of wave 1 to wave 2 data. I've had the privilege of working with a team focused nationally, and we found similar levels of interest back during that same wave 1 time period. These wave 2 data are hot off the press, and I think provide some concerning and I hope motivational information for all of us here in terms of trying to make certain that when COVID-19 vaccines are approved for use, as we expect they will be later in the fall and into the winter time, we're going to want to encourage families to get their kids vaccinated and help us push over what we hope is out there as a finish line in terms of beating back COVID-19 in our communities. Next slide, please. When we take a look at differences in COVID-19 vaccination plans, these parallel the levels of concern. So here in wave 1, you see that among non-Latinx Black parents, their proportion very likely, and Latinx parents somewhat higher levels of very likely, were lower than the non-Latinx white and multi-race other groups. I say parallel, but in a inverse way, in effect, because these were somewhat surprising to us to see the very likely proportions lower among non-Latinx Black and Latinx populations, even though they reported being more concerned about COVID-19. This, of course, connects to what has been described in the lay media and also in the health and healthcare journals about distrust of minority communities with regard to vaccination programs that has its origins in mistreatment by the healthcare sector and even by the public health sector with regard to vaccination, public health programs, for example, the Tuskegee syphilis experiment, but also probably and unfortunately has its basis in continued perceptions of different treatment by the healthcare system of non-Latinx Black and Latinx populations. So let's take a look now on the next slide at where this sits in terms of the differences in COVID-19 vaccination plans by wave 2. And we can see that, as we showed you earlier, the overall intent of very likely vaccination for children has diminished over time, and non-Latinx Black parents have about the same proportion very likely, which is at the lower end. The levels of interest among Latinx and multi-race other parents have also ebbed. These types of data certainly indicate some levels of concern for us in terms of trying to make certain that all communities in Chicago get the protection that a COVID-19 vaccination will offer. They also can help guide us in thinking about what messaging would be important. How do we want to approach communities that are at particular risk for COVID-19 and for whom the likelihood of vaccination against COVID-19 for children in the future appears to be lower than what we would really like to see optimally. Next slide, please. Now we're going to shift to the topic of parenting support. We like to ask about parenting support mainly because it helps guide us around trusted sources of messaging. And we can see here on this slide, when we asked Chicago parents how supported they felt by various different sources that we asked about, and we sourced the list of supporting groups from discussions that we've had with our own family advisory board at Lurie Children. We see here that the 3 groups or sources of support that parents endorsed as feeling very supported were their children's doctor, grandparents of their kids, and that child's other parent, that is to say, the parent who is not answering our survey. You can see that these levels are at a very similar level, and they were at the top of the list. Next slide, you can see that several other sources here were, for more than half of the parents, also help parents feel very supported: a child care provider or teacher, other relatives, and their own friends. And it's important to emphasize here that with the major shifts until very recently, when we started to have more in-person settings for education and for early life childcare, to not have our children's childcare providers and teachers as readily accessible to parents because we are all in either not having those meetings, for example, childcare, or we are having online meetings instead, was a disruption of a major source of parenting support for many parents. In addition, we see spiritual leaders here as a source of strong support for about 2 out of every 5 parents, and social media on the bottom. We want to emphasize social media here because although it is endorsed as a source of support by many parents do not feel very supported by it. In other words, we're concerned at the Voices of Child Health in Chicago, and this is certainly based on some other work we've done around social media, that while a lot of parents engage in social media, many parents don't find it to be a source of support. That's a cautionary tale, I think, for many of us who are trying to lean into social media as a way to reach parents, because we are going to be in that social media stream with many other sources of information, and it can be difficult to reach parents and serve as a source of strong support for those parent audiences. Next slide, please. As Raul mentioned in the lead-in here, we've also taken a look at perceptions of work-life balance, because that's certainly been a topic in many media sources, and certainly for the parents that we've spoken with in our clinical work here at Lurie Children's. And when we've asked how difficult is balancing work and family responsibilities for you, 55% said is very difficult, or somewhat difficult. 32% said, you know what, I got this. It's really difficult. And 13% said, yeah, I have this figured out. It's never difficult. But you can see there, the majority said that this is difficult, at least to some extent. And importantly, parents who reported lower levels of parenting support in the previous slide were more likely to find it difficult to balance work and family. What does that mean? It means we've got to help parents find those external sources of support in order to help them feel that better sense of balance. Next slide, please. We're going to take a look now at how often when you are at work are you worried or concerned about your child or family issues. Not surprisingly here, we found parents endorsing very often, or sometimes, more than half the time. And this is something that's of concern, obviously, for employers, including employers in the public health and healthcare space, for whom a majority of their employees are likely distracted or all out worried, very concerned about what things are like for their children or their family issues at home during this pandemic. It has been an extraordinarily stressful time. Certainly, we've been concerned about that at Lurie Children's for our workforce, and I don't know a single employer for whom it has not been a concern over the last 13 months. Next slide, please. We're going to turn now to the topic of behavioral health and the concerns that parents have had about their children's behavioral health over the course of the pandemic. We found that nearly half of parents said that they had talked with their child's primary care provider about mental health concerns for their kid in the last 6 to 12 months. About a quarter of parents said their child had used mental or behavioral health services in the last 6 to 12 months. And 18% of parents, about 1 out of 5, said that they could not get the mental or behavioral health services they wanted for their child. So this is a substantial concern, but unfortunately is probably familiar to many of us who are trying to support families through their behavioral health needs right now. About the same proportion of parents said their children had used mental behavioral services versus those who said they could not get them. And certainly, Raul, I'm sure we'll touch on this in our Q&A. Aunt Martha's is really strongly focused on behavioral health services for youth, as are we at Lurie Children's. It is difficult to catch up with what has essentially been a tidal wave of need that has been unleashed by the pandemic and all the changes in the family routines and children's routines that have come with really being disrupted from their usual educational settings. Next slide, please. We asked the group of those 18% of parents who said, you know what, we've had difficulty getting access to mental and behavioral health care. We asked them, well, why was that? And over half said it was difficult to find a provider for their children. About 2 out of 5 said it costs too much. Sometimes families find it difficult to have their health plans support the type of care that they're looking for their children. Another 2 out of 5 said they could not get an appointment in a timely fashion. About a quarter said they weren't sure where to go. And about 10% said they could not get their child to go for services. That is, the child herself or himself was reluctant. So the respondents could have endorsed more than one of these explanations, but suffice it to say that we have here many parents who were concerned about access barriers related to cost or access barriers related to availability, and furthermore, just some difficulty navigating a system that they may not have needed or found that they needed to navigate before as their child developed behavioral health concerns. This is a matter of wayfinding for families in communities, and the parent network can be very helpful for some parents in terms of connecting to services that one family may have found useful and can be also helpful for another family. But because the network of behavioral health services isn't necessarily as robust as the primary care network here in Chicago, this is fundamentally a challenge for many families who are looking for this type of service for their kids for the first time. Next slide, please. We also ask parents, what sort of symptoms are your children having that have been really the clearest sign to them, the parents, that their children are having behavioral health concerns. And so we asked, is your child having any of the following symptoms more often than before the COVID-19 pandemic? In other words, we didn't ask a group of parents, tell us about the behavioral health symptoms your children were having. Instead, we asked them about things that they may have noticed. And so you can see here the most common was tantrums or acting out. And that corresponds directly with some findings at the national level, where we found that the age group of children for whom parents were most worried about behavioral health changes or worse behavioral health during the pandemic than before were the youngest kids. That preschool to early elementary school age group has really been the group that has been a very high need, new symptom age group for parents to experience and try to help their children deal with it. Clinginess, again, much more of a young child type of symptom. Nightmares and sleep disturbances, there you see as the third most common. And then we see what we often see in healthcare settings where that psychic anguish of distress of behavioral health shows up as somatic pain, headaches and stomach pains. Also bathroom accidents for children who previously had been potty trained, maybe now not sleeping through the night without an accident or losing the potty training that they had before. That's a classic challenge that we find with children who are younger in age and going through some behavioral health distress. And finally, difficulty getting along with other kids. Interestingly enough, as a pediatrician, I would say that's one of the earliest signs we'll see in a non-pandemic time that we'll hear about from parents about their child not really relating to kids as well or not getting along with them as well. But because the pandemic really curtailed a lot of that peer interaction, doesn't show up as often here. Instead, we're seeing more of the tantrums and the clinginess for these early age kids. Next slide, please. So what does this look like then in terms of Chicago and the sheer magnitude that we're talking about for behavioral health concerns or mental health symptoms during the pandemic? Well, overall, 44% of children in the sample 2 to 11 years old here experienced one or more behavioral health symptoms that we just talked about in the last slide. So we've extrapolated that to the finding, or extrapolated this finding to the population of kids in Chicago 2 to 11 years old. That's more than 70,000 children who may be affected. 70,000 children who may not have been part of the behavioral health care landscape here. We may not have known they had needs before, who will be looking for care in ways that we're struggling to keep up with here in the city, and we need some innovative ways to try to address this level of need, this magnitude that we're experiencing as a city. Next slide, please. What has changed then also in terms of children's activities? And you see there's a yin and yang of the behavioral health distress and the disruption to usual activities. And that's what we try to capture here in these questions. So we asked, compared to before the COVID-19 outbreak, how much is your child doing the following now? And these are findings from wave 1. So this is already last summer when we were experiencing the stay-at-home order. And you can see, and these aren't necessarily surprising, but the magnitude may surprise you. So in-person time with friends, 80% of kids were experiencing less than that. Time outside, 73%. Physical activity, 50% were having less time and only 12% more. I would say that at Lurie Children's, and I'm sure this is something that some of you may also be seeing in other healthcare settings, we're seeing the effects of less physical activity on children's overall health in terms of their sense of well-being, and also in terms of their weight for their height or their body mass index. We're seeing some pretty challenging circumstances for children who, for whom weight for height may have been a concern prior to the pandemic and has become a even more substantial challenge during the pandemic. Remote time with friends obviously has become something that our kids needed to adapt to, and honestly, our kids can adapt to it faster than many of us grown-ups can, and so that has been something that they've innovated themselves and has been something that, to some extent, been a creative outlet for them. Sleeping, on the other hand, has perhaps been, while adaptive in some ways to the distress of the pandemic, has also potentially been something that's been disrupted for kids. Eating is obviously connected to the challenges of less physical activity, and the non-educational screen time and educational screen time obviously has been a part of the pandemic that perhaps has characterized our time at home even more than anything else. That's just a lot more screen time, which already we were fighting a battle about in pediatrics before, and now has become something that we've had to grapple with in a totally different way because of all the online educational activities that our kids have been involved in. Next slide, please. So if we go to the next slide, what we can then see as our key takeaways is that concern about COVID-19 and the intentions to vaccinate not only differed by personal and social factors, but are changing over time in ways that reflect how we as a population and our communities as families are experiencing COVID-19 and are processing their own sense of comfort versus concern. Parents are reporting a high level of parenting support from their children's doctors, grandparents, and other parents, more so, certainly more so than social media. And behavioral health symptoms have certainly increased for young children, and access to care remains a substantial concern. Even knowing where to access behavioral health care is a concern for a substantial group of parents looking for that help for their kids. So let me close on the next slide by touching on a couple ways to contact us. First of all, I'm grateful to the team of professionals, really experts in parenting, parent survey, for that matter, parenting, many of them, and Marie Heffernan, Tracy Smith, Ann Bendelow, Jazz Bahati, and Mia Casale are just fantastic colleagues and have really made Voices of Child Health in Chicago an early success for us at Lurie Children's. We are easily reachable via the web and always via email with your ideas. And we want to be able to ask questions that matter, certainly to the communities we serve and also to our colleagues in public health and healthcare. So if you have particular areas of curiosity or questions that you would love to see us ask in a future wave of the parent panel, please reach out to us and let us know what's of interest to you. Thanks, Raul, and we can go through questions now.
Yeah, thank you. What an excellent presentation that's been supported by world-class research, not surprising. So thank you, Matt, to you and your team for bringing this to the surface. And let me just remind our participants to please send your questions into the Q&A function, and I'll go through them. So I'm just going to get right out of the gate. Oh, and by the way, also, thank you for the plug on Aunt Martha's. Now you've spared me so I don't have to shamelessly plug my own organization. But we are very involved in children and adolescent behavioral health, and have really innovated around telepsychiatry over the past 14 years in an integrated way. So there's more on our website if people need support for those services, as well as at the Lurie Children's Hospital. So let me just get right out of the gate and ask you one question here that's been on my mind. So how do you translate the findings that come out of the Voices program into actionable change that can be implemented at the practice and patient level? For example, how do these findings affect or influence your work with the next generation of pediatricians, like those students at the Feinberg School of Medicine?
Thanks for that question, Raul. And our aspiration is to ask questions that are actionable. We want to know not just to know, but to do something about it. So for example, in the work that I've just shared with you, when we ask about sources of information, as I alluded to, we want to be able to leverage that insight to help the people who are responsible as those sources of support to know that they are seen by parents as strong sources of support in ways that they can lean into that and perhaps devote even more attention to it. So for example, we have the privilege of working with many communities of faith throughout the city of Chicago. They need to know that parents are looking to them for information about COVID-19. Parents are looking to them for information about what they should do regarding vaccinating their children. Well, community faith leaders might not feel like they're a source of authority on that particular issue, but what we can do in the healthcare community is reach out to those leaders with whom we're close and saying, you know what, here's the best information. Here's reliable information that we hope you'll share with your communities. Similarly, across the healthcare community, we can say to physicians, nurse practitioners, and care teams in clinics, federally qualified health clinics, private clinics, and broader medical centers to say, you know what, we are a front line of that information, and look what's happening to parents' interest in vaccinating their kids against COVID-19. It is going down. Now is the time for us to start preparing for the opportunity to vaccinate kids more broadly that will come this summer and into the fall and winter. Let's start those conversations now. Let's pave the way to a broader base of acceptance and also engage in trust-building conversations with communities that may not feel so trusting right now around these vaccines, because we're going to want to gain their trust in time to make a difference.
Yeah, I think that's exactly right. You know, I'm also serve on the board of the Cook County Health System, and this is a point we talked about earlier at our board meeting, that I think the more people see other people and hear about other people being vaccinated, the more likely they are to be vaccinated. And I just think we have to continue to get those testimonials out there. One question coming in from the audience here: are the Wave 1 families and Wave 2 families the same sample, or are they completely different groups? This person says, I know we filled out a survey in the fall, but never received requests for a second survey. So I wonder how many of the second surveys were completely different families.
This is a really smart question. Thank you for this question. About 25% of the families in Wave 2 were also in Wave 1. And we rely on our survey partner, NORC, at the University of Chicago to help provide a sample that is going to provide that longitudinal touch point so that we have those repeat responders, but also refresh the sample in a way that makes certain that we are as timely as possible in terms of capturing the perspectives of parents across the city.
Great, that totally makes sense, Dr. Davis. Let me take another question from a participant. For the people who want to vaccinate their children that are 16 and up, often when scheduling appointments, they are not made aware which vaccine it is. Only Pfizer is approved for 16 and up. This wastes valuable time for already overwhelmed parents. What can we do to encourage vaccination sites to provide this info up front?
Great question. And this is an example of one of the biggest challenges of the COVID-19 vaccine effort, which is that we have different products that have different approaches. Sometimes, as this person is pointing out, different, we would say, indications or different authorizations. So this is a good example of how particular channels of information, for example, through schools or through faith communities or through parent groups, for example, including online parent groups, which can serve as strong sources of support for parents who depend on them, can be really helpful so that when there's calling or going online to schedule an appointment, that they can ask this question in a knowledgeable way and say, are the doses that are going to be provided here appropriate for my child? I think that because children have not been so much a focus of the COVID-19 vaccination effort to this point, but they will be going forward now that we have advanced to the next phase across the city and across the county. We need to be able to provide exactly this type of information, because obviously it matters directly to the people who we're trying to protect.
Great. That's right on point with that. Let me work one of my own questions in here. With the very little bit of hindsight that we were afforded at this point, when it comes to the support people really need, what lessons have you learned from your perspective as both a pediatrician and as a public health researcher that make you think, I wish we would have known this last March?
Oh, what a fantastic question. The tragedy of this, from my perspective, speaking candidly to this group,
Sure.
is that we knew from multiple past epidemics and pandemics that communities that are underserved historically or experience discrimination historically will have a harder time, period.
Yeah.
So the efforts that were put in place early to try to reach out to communities of color here in the city through the Racial Equity Rapid Response Team that tried to bring people together around a table to figure out ways, with very few resources and not a lot of knowledge about COVID-19 earlier, how could we try to change the outcome for better? I believe that those efforts did help reduce some of the morbidity and mortality, but we know we wish we could have done more as a city. So that, to me, is something that I hope here in Chicago we will take as a lesson, is that there will be another pandemic. We don't know when and we don't know what about, but we know that we can do more today as we prepare for the next one, to do more to help ensure we have effective communications across all communities, which really depend a lot on our opinion leaders and our trusted sources of information. And I would very much hope that our city can help build that trust network across all neighborhoods so that we can basically get the word out to communities about what is a dependable source of information. Here's what's available, here's what you need to know, and what are we going to do about what's uncertain today? Because so much of COVID-19 has been about uncertainty from the beginning. What should we do? How do we keep ourselves safe? How can we get the right care to the right people at the right time most effectively? We're in the same period of uncertainty now around vaccination. And it's been frustrating, upsetting for so many people, and ultimately has been a challenge not only here in Chicago, of course, but in so many locations, not only in the United States, but around the globe. So uncertainty continues, and from my perspective in pediatrics and public health, the best way to address uncertainty is with a candid explanation of what we know and what we don't know, and a commitment to getting answers to the questions that we don't yet have answers to.
Yeah, it's really a shame that it took a pandemic to really bring this to a place of where it's obvious that different actions need to be taken. But I also think it's an opportunity, and just as information, yesterday, federally qualified health centers across the country, and of course, including those in Illinois, were notified that they received an additional funding award coming out of this $1.9 trillion stimulus, and it's substantial funding for us, and so I think therein lies an opportunity for us as FQHCs to really drill in deeper and do more as a result of those resources being available to us. I mean, it's unprecedented, the level of funding that we've received, and so we're very thankful for that. But then I think it's about really pledging and leveraging that to address the kinds of things that your research has surfaced, Dr. Davis. This is a question coming from a good colleague, friend of mine, who's also a leader in behavioral health across the state. Dr. Lurie Jones. She wants to know, are you aware of the best screening tools to identify these issues in kiddos on their PC visit?
Thanks for that question. That's something that I turned to my colleagues at Lurie Children's, led by John Walkup, a child psychiatrist, and John Levine, child psychologist, where what we've done is we've chosen to implement a instrument called the PSC, the Pediatric Symptom Checklist 17, that helps you in one pretty rapid instrument, certainly that my patients fill out eagerly without difficulty, a perspective on their attention, their internalizing symptoms, so things like anxiety and depression, and also their externalizing symptoms, so things that would be creating more difficulties in their interactions with other people, in their families or with peers. And based on those initial subscales, we would call them, the smaller groups of questions within the PSC 17, then you can go from there to other instruments that will help you understand in more detail whether the children would benefit from particular help, whether it be follow-up with talk therapy, medication, or some other type of intervention. So the PSC 17 is what we've chosen to go with after a lot of consideration of the multiple instruments that are out there, and it's something that for us has been working effectively.
That's great, Dr. Davis. We are at time. I know we could probably sit here for hours pouring through these really critical discussion points, but we end at one. And I want to thank you again on behalf of the Institute of Medicine Chicago for your great work, your world-class work. It certainly is great to see you or hear you again. Sorry, we couldn't be seen. We had some difficulties there, but man, you're just continuing to do great work. And I know we all appreciate it in our communities, especially in our communities of color. So thank you, Dr. Matt Davis.
Raul, thanks again for the invitation. Thanks for moderating today's session. And thanks to all of you for attending. I want to emphasize in closing that Voices of Child Health in Chicago will be better if you contribute your questions about how we can elevate the voices of families here in Chicago. So we look forward to working with all of you in the future. And thanks for joining our discussion today.